Today we are going to learn about bone metabolism. Bone metabolism, it is a balance between bone formation and bone resorption, which is governed by parathyroid hormone, vitamin D, calcitonin, growth hormone, thyroid hormone, and glucocorticoids. 99% of the calcium is present in the bone in the form of hydroxyapatite, which is the storage form. 1% of the calcium is present in the intercellular fluids in the cells. 0.1% of the calcium is present in the blood and extracellular fluid, out of which 45% of it is bound to proteins, 45% is in the form of free calcium, and 10% is present in the form of carbonates and citrates. The function of calcium is utilized in muscle contraction, nerve conduction, and clotting mechanisms of the blood. The homeostasis of calcium and phosphate is dependent upon the gut, the bone, from which the calcium and phosphates are mobilized to the bloodstream. The absorption of calcium is increased by acid in the gut, vitamin D, bile salts, and PTH. All these promotes absorption of calcium. Phosphates, fats, and carbonates decrease the absorption of calcium by binding the calcium which is available for absorption in the gut. Alkaline pH of the gut also decreases the absorption of calcium. The deposition of calcium inside the bone is increased by its availability in the food, alkaline pH of the blood, and vitamin D. However, acidic pH, parathyroid hormone, excess of vitamin D, and inactivity of a person is responsible for resorption of calcium from the bone and its increased amounts in the bloodstream. The factors in the blood which are favorable for high level of calcium are an acidic pH, increased parathyroid hormone, and decreased ionic strength. In the bloodstream, the calcium is being interchanged between its ionized form and the calcium phosphate. Similarly, if we discuss phosphate, 86% of it is present inside the bone in the form of hydroxyapatite. 14% is inside the cells in the intracellular fluid. However, 0.08% of it is present in the form of inorganic phosphates in the blood and the extracellular fluid. Now we will discuss the formation of vitamin D in the body and its role in the calcium metabolism. Vitamin D is formed by its precursor 7-dehydrocholesterol, which is converted inside the skin to pre-vitamin D3 and to vitamin D3. Vitamin D is also obtained from the diet in the form of D2 and D3, and it is transported via chylomicrons in the bloodstream. The inactive vitamin D obtained from the skin and dietary sources is taken to the liver, where it is hydroxylated by 25-hydroxylase enzyme, which is present in the liver, and converted to 25-hydroxy vitamin D. This form is transported in the bloodstream towards the kidney, where it is converted to active form the calcitriol, which is the 1,25-dihydroxy vitamin D3 by the enzyme 1-hydroxylase, which is activated by parathyroid hormone. Vitamin D3, the active form, acts on the bone. In the gut, it increases the absorption of calcium. It promotes demineralization of bone, which finally leads to increased calcium in the bloodstream. Decreased level of calcium in the bloodstream is a stimulating factor over the parathyroid glands, which are present inside the thyroid gland, and parathyroid hormone is released. The PTH, we already discussed, acts upon the kidney to activate the 1-OHase enzyme. It promotes the absorption of calcium from the gut, and it promotes bone resorption. All this leads to increase in the level of calcium in the bloodstream. But we would like to specially mention here that this hormone leads to increased phosphate excretion from the urine, and it is also known as phosphaturic hormone, and it decreases the level of phosphates in the bloodstream. Now finally, the third hormone, which is calcitonin, it is secreted by the clear cells from the parathyroid gland, which is stimulated by increased amount of calcium in the blood. It is the only hormone which is acting on the bone to decrease the bone resorption, due to which the level of calcium decreases in the bloodstream. Thank you very much. This was the calcium metabolism in brief.